Greetings, sorry, looking in the wrong place. This is my third attempt at trying to record this fourth podcast, but I never seem to get this technology my Bob business right. I've now had 2 weeks of chemotherapy, 2 weeks of chemotherapy and my week off, in inverted commas. It's not actually technically a week off, it's still part of the treatment, but that's just the way it works. The last podcast I did, I held up a piece of paper with the name of the treatment that I was taking, and I think it might have come out backwards, so I'll spell out what this treatment is so you can look it up a bit more clearer than last time. How to spell this treatment is CAPECITABINE. Capaceta. I've spelt it, you pronounce it. So far, not many side effects, praise God. My hands aren't sore, my feet aren't sore. I've had some nausea. Mother Nature has been a bit of a pickle once in a while. And I do get quite tired. But I'm also on a truckload of morphine at the same time, so it kind of adds to that a little bit. Pain levels have increased during the night. So again, the morphine levels are going up. I've had a couple of wobbles this week emotionally. Every now and then it does hit, and it hits hard, reality of my situation. I keep myself busy, but a lot of your patients will be keeping busy. Are they keeping busy because they're hiding from the reality of it, or are they just naturally people that keep busy? Sometimes we can think too much. But it's interesting just to think about. I had a consultant appointment yesterday, and the lady consultant I saw this time had a rummage in the relevant areas and had a poke around the liver area, which was uncomfortable this time but not as painful as last time. My appetite has increased, but my weight seems to be going down a little bit. Go figure. But one thing that did trouble me was that she gave me, because I've been having pain in my upper groin, my upper hip area, she sent me along for an x-ray, and she said if I haven't heard anything within a week, then assume everything's okay. It's kind of like a job interview. If you haven't heard from us within 2 weeks, then assume you haven't got the job. That's the way I was left to feel. In my situation, I'm afraid you kind of start second guessing every ache and every pain, and you start wondering if this is the beginning of the slope. The same thing with the blood tests, and I think this is right across the board, is that sometimes they say, well, if you haven't heard anything, then assume everything's fine, or if you are concerned, then ring up in a few days, but give it a few days. And you don't tend to want to ring up, really, because you don't want to feel as if you're troubling them by ringing up and asking for blood test results. At least that's me anyway. Particularly somebody in my position, maybe, or somebody who's got a cardiac history, or somebody with a family history of something. It just takes a few minutes or a few second phone call just to ring up and say, hi Mrs. Matthews, this is so-and-so from Southampton General Hospital. You had an x-ray the other day. I'm just ringing to tell you that everything is clear. There doesn't seem to be anything. Perhaps it's more muscular than anything. There's no shadows anywhere. And just increase the painkillers for a little while, and I'm sure it'll ease off after a few days. Those few words can be extremely reassuring for somebody like myself, as I said, who second guesses. And it's hardly surprising that I'm second guessing everything. I had, when I say wobbles, I mean I get times when I'm very scared and the reality of the situation hits home very badly, and I start feeling a bit guilty as to the pressure and everything I'm putting on all those who I know and love. I have times of tears and real deep tears, but that's being real, isn't it? Again, that expression, being real. For me, this podcast, the message I guess from this one is just take a few minutes sometimes to reassure your patients if they've had some tests and if you've got the results. And if they're fine, if the results are fine, don't just assume that the patient's going to assume that they're fine. That patient is possibly sitting in their bed going, what are the results, what's happening, what's going on, but they're too polite to ask, or they feel too vulnerable to ask. Just let them know. Just say, blood tests are back, they're okay. Or, you had that x-ray result the other day? Not a problem. Spend a few minutes explaining a situation to a patient, because sometimes we know more about our conditions, situations, than we do, because we're living them, we're not reading about them. Okay, till next time. Gosh, I sound like Jack and Rory. Till next time.